Hello, everyone. This is the first ever video or podcast of House of Cure presents DocTalk, where we'll just be having a chat with Dr. Abhijeet Ahuja. He's a pulmonologist, and he'll give us a great idea as to why and what and everything about the COVID vaccine. Okay, hi guys. Thank you so much for joining. We're just waiting in for. Hello, guys. Hello, everyone. So I've been going around with a lot of, asking a lot of people questions regarding. Can everybody hear me? Can I get a thumbs up? Could you check if you can hear me? Yes. Okay. Thank you. So I've been going around asking a lot of people regarding what questions they have about the COVID vaccine, about COVID, what COVID is, how to register, is it open for everyone yet? A lot of us here are healthcare workers, and so it would obviously be comfortable for us to go and get our vaccines, but a lot of people, like our relatives and friends, who really want to know about it and want to get vaccinated or have like some kind of inhibitions regarding it, uh, we should be clearing out, it's our duty to clear out these doubts for them. So we'll be talking with Abhijeet Ahuja. He is a pulmonologist. He's completed his training in respiratory medicine from DY Patil, and then he completed his interventional pulmonology from Rajiv Gandhi Cancer Institute, New Delhi. Besides that, he's won a lot of awards. He's presented a lot of papers, all over the globe, and right now he's a specialist in bronchoscopic intervention. We'll just wait for him for a minute, and we'll be adding him. Hello, guys. Hi. Thank you for joining. So a lot of people who've just joined. This is we're trying to present the first ever podcast by House of Cure. It's known as Doc Talk. I would like to say my big thanks to Mr. Kushal Garde for suggesting this brilliant name, where we'll just get together with doctors from all professions, all specialities, just so that this video goes out to a lot of our patients, and they realize how important, and realize the important topics that need to be discussed on a healthcare front. Just a second, guys. Abhijit is unable to join. Okay, guys, so once again, big thanks to Kushal Garde for suggesting this brilliant name, Doc Talk. Hi, guys. Thank you for joining. Thank you. For all those who've just joined, we will be having a chat with Dr. Abhijeet Ahuja. He's a pulmonologist, and he's currently working in three different hospitals: Safi, Marine Lines, Global Hospital Parel, and Shushruth Hospital in Chambur, where he's practicing interventional pulmonology. Guys, so if you guys have any questions regarding the COVID-19 vaccine, and I would just like to note them all down. And we can, after a round of questions is over with Dr. Abhijeet, we can continue with the questions that you guys have regarding the vaccine. Thank you, guys. Thank you. Yeah, guys, I'm taking any questions if you have any regarding the COVID-19 vaccine. Even as healthcare workers, we're not exposed to every single, you know, everything out there regard any information regarding it. So any questions at all, please, which vaccine to take? That's a good question. In fact, I just read up on this, but we'll let Dr. Abhijit answer this. So the problem right now, what's coming up is that right now we just have two or three vaccines in India, two to be very honest, Covaxin and Covishield. And but right now, within 6 months or a year's time, we'll have 10, 15 other vaccines come up. So which vaccine to take? Because everything will be available then. Great question. I'm just going to note that down. Must have created that. Okay, that's another. Covishield or Covaxin, there's nothing better, guys. They're both vaccines. They're both 100% effective in making sure that you don't die after, if you contract the virus. So that's like the main thing. But blood clots due to Pfizer vaccine, that's a great question. Yeah. What do you mean by what is the best time to take, as in now or 6 months from now, or you mean like morning or evening? Feeling weakness? Okay, Priya, so I went through a similar feeling after I took Covishield, but that lasted for like 24 hours, a bit of weakness, but 24 hours is max. Uh, Imran Khan is I positive after taking 2 days. Yeah, I've heard of this, but I haven't read up about it. So I won't be answering why Prime Minister Imran Khan has been tested positive. But we will ask Dr. Abhijit regarding this. So if you guys read up at all regarding why you get fevers, chills, or all of these symptoms are not caused because of the vaccine itself. They're caused due to your body's immune response to the vaccine. So in a way, it's good that you are, just a second. Yeah, in a way, it's good if you get fever or chills. It's just your body's reaction. Hi, Dr. Abhijit.
Hi, finally.
Yes, finally, we have a lot of people waiting. We have a lot of questions here, and we're looking forward to your answers.
Definitely.
Okay.
Thank you, House of Cure, Dr. Karan, Dr. Janvi, for having me on board. I feel this is a very important question because me being a pulmonologist, I've been in the fight against COVID since the beginning, and
Yeah.
I've seen this final answer to come out, the vaccine, which we were all waiting for since a while. But unfortunately, we have a lot of skepticism. We have a lot of doubts in the people's minds. A lot of
Yeah.
media coverage about the side effects of the vaccine, and what not to do, or rather how we go about saying is to not take the vaccine. Should we wait for it? Let's just try and kick this all the issues out and keep it clear that it is safe. And I'm sure by the end of the talk, most of the people will be clear with their ideology about the vaccine itself.
Absolutely. So, before we start anything, I just want to say I think this is the perfect day to start this because it's been 1 year for the lockdown now, and I think I can't think of a better day to start, House of Cure's Doc Talk, and you being our first guest. And it's really amazing. I remember a year back we were banging plates and so that was another experience. And who would have, I mean, we were all expecting 1 year, a little more, but we are at least, I'm very happy to see that after a year now, we at least have a vaccine in hand. And you're here to clear those doubts for us.
Yeah, so we have in fact two. One is which has been made in India, the other one being made from the Oxford, the AstraZeneca one, and we'll be having a few more in the pipeline, which will be now also having people having a choice of taking which one. And for now,
Right.
we can focus on the two which are available in front of us. And we should probably be looking forward to the vaccine rather than waiting for more answers about the vaccine because uh, we are already seeing a rise in the cases. We will not be
Correct.
able to vaccinate at a pace where we can expect everybody to be, having immunity altogether and then say goodbye to the virus. I think it's important that when our turn comes, we be the first in line and just take it.
Absolutely. So I think let's just begin the topic with because a lot of people are not doctors and they want to know like, what is COVID and how do you get yourself registered or, get in the process of getting the vaccine. So could you enlighten us about that?
It's quite simple. They have come up with a app called Covin. However, we need to, if anybody needs to get registered, that is the first step. You need to register before you go for
Right.
the vaccine. The other option is if you're not able to register, you go to the center itself, find out if the center is doing the registration on the spot because most of them have started doing that, especially in the private setups.
Right.
If you want to, cut that queue and get into the queue just for the vaccine, then you should register at home to begin with. Go to the website cowin.gov.in and register yourself. It's quite simple. You have to put in your details, your Aadhaar card or your passport or any photo ID which has been issued by the government and some details there, and then you're registered. After which you get the option of selecting where you want to take the vaccine. However, recently, in the past couple of days, that has also been bypassed. You can just register and go to the center near you. Because what we
Okay.
had seen in the last month, when mass vaccinations began for people aged 65 or above, is that you were to select the center to go to after registration and then report to that center only. However,
Right.
because it was a difficult task. The servers were overloaded. You're not able to get the dates, and it was not really falling into place. So, what they have done right now is in the past few days ago, they've announced that okay, just register and then go to the center near you. They will
And
check your
get it done.
details and get it done.
That's really nice. So COVIN is apparently the short for COVID Vaccine Intelligence Network. I just found that out recently. Okay, besides that, what vaccines are available? If you go to these centers once you're registered, what are the vaccines that will be available to us?
Usually, there are two vaccines which are available pan India. That is Covishield and Covaxin. Covaxin has been developed in India by Bharat Biotech, and Covishield has been developed by AstraZeneca and the Oxford Institute, and it's being produced here in by Serum Institute of India in Pune.
Right,
So the option you usually don't get one. There are few centers like to begin with. JJ Hospital had the option of whether you want to go for a Covaxin or Covishield.
Covishield.
As of now, we are seeing more centers coming up with Covaxin as Covishield. The number of the stock has gone down because there were only very few centers giving out Covaxin. Most of the centers
Right,
were giving
right,
out
right.
Covishield.
Correct,
But
yes.
matter of fact is both the vaccines are effective, both the vaccines are safe, and regardless of whichever vaccine is being provided into the center, I would strongly advise the person to go and just take it.
Okay. Uh, could you like just enlighten us regarding like the basic differences between at least these two vaccines that are available right now? Because later on, I believe in 6 months' time, we'll have another 5, 10 more vaccines come out, and we'll be lost with the details. But at least with these two vaccines, which are now mass, available to the mass, what are the basic differences?
Basic differences is the way they're made. So if you talk about Covishield, it does not have the the SARS-CoV-2 virus itself. It has a weakened version of the chimpanzee virus called an adenovirus, which has got the proteins which are the spike proteins, which are the same as the ones which are present in the SARS-CoV-2 virus. So
COVID
basically, you have
virus.
been injected with another virus, but it has got the proteins which resemble the one which are there in the SARS-CoV-2, and it makes your body produce antibodies to the same. So you're developing an immunity against the virus. Whereas the
Okay.
Covaxin contains the virus itself, however, it's a killed virus. It is not a live virus. So basically, it's just basically the body of the virus, but again, it has got the proteins intact. So the body will be able to recognize the infection once again if you're infected to the virus.
Right. And what about the efficacy rates? Now, there has been a controversy going on regarding the efficacy of these vaccines. Which one is more efficient, which one is not. You go ahead. I mean, I have also done a bit of reading regarding this topic, but you go ahead first and then we can have a chat regarding that.
So the efficacy, the trials that were shared with everyone is that Covishield gives you an efficacy of up to 71% after the second dose, which has been taken after
Okay.
28 days. Whereas Covaxin, the phase 3 trials, the whatever the trial data that has been shared recently shows that it has got a superior efficacy of 81%. However, the thing to note here is you are not looking for uh, the 10%, which is the difference between the two vaccines. 70 or 80, it's good enough. Secondly, this means you are being protected 70% or 80% against a mild disease. So if you get the virus, you'll just get away with the mild disease. Both the vaccines will give you a mortality benefit. You won't die from COVID if you get COVID.
Right. Yes.
So that is very important. You do not look at the numbers. Whatever the numbers say, both the numbers, in fact, are almost as close as they can get. And I'm sure we really don't have any vaccine to date giving 100% protection. Very close to 90s range is what we usually target, and this one being in 70s and 80s is good enough.
So basically, the aim of the vaccine is not to say eliminate or in a way that I will never get the virus, but the fact that even if I do get it, it'll be a very mild symptom and it
Precisely.
won't exaggerate towards, where I get into hospitalization or
The
unfortunately
ICU,
death.
yes.
So basically it would almost be is very clear to say that all vaccines are effective in making sure that the symptoms are controlled, right? And
Exactly.
COVID doesn't
So yeah,
affect you in a serious manner.
in a serious manner, exactly.
Okay. Okay. Another thing that I read actually regarding this efficacy is that all of these efficacy studies cannot really be compared. We can't
Mm.
really compare Covaxin to Covishield because they were never put to the same trial at the
Exactly.
same time. Uh, every time, I mean, different population, different areas. Unless we put all of the vaccines together in a same trial, only then we'll get to know the real comparative efficacy. Otherwise, it will be impossible to tell which one is, related to efficacy. But
Related
the
to.
point to remember, as you said, is it all of them prevent us from reaching a very severe stage of the COVID virus disease.
Also, both of them are safe. That is also another thing to actually take home, because what we need to really worry about, we are taking something, whether it's actually safe or not. When you talk about taking any medication, it's the first thing you actually bounce about saying, okay, I'll be taking this for getting treatment, but what are the side effects?
Right.
So if you look at the side effect profile of both of these vaccines,
Yeah.
um, Both of them are quite similar. Covaxin has shown a less amount of fever, less amount of people getting the fever. However, Covishield, you can say more people are getting fever the next day after vaccination. However, it is controlled. Basically, they do give you paracetamol along. You need to take the paracetamol and it takes care of it. After which, there is no long-term side effects that you're looking at. There are no no issues which keep prolonging, keep hanging around with you after vaccination. So both are safe.
Right. Okay. That's really helpful to know because a lot of people are really scared about taking the vaccine. Immediately because after I took Covishield, I had fever for about for 24 hours that night, and then I was okay the next day. That evening, I felt really fatigued, and immediately the next day, I woke up as if everything is fine. Nothing ever happened. So that was kind of a funny experience. But I believe it's important to go through those symptoms to know is it true that all these symptoms are in a way good, that your immune system is basically kicked in?
Well, this is something which is very subjective. Some people will get the fever, some won't. With the vaccines previously that we used to get, we used to wait for the fever to come, and when they used to say, okay, your immunity has actually kicked in. But
Right.
with this vaccine, particularly, there are a lot of there are a lot of individual factors within the person that matter. So whether you get the fever or not, I think getting the vaccine itself, both the doses, should give you equal amount of protection whether you've got the fever the next 24 hours or not.
Okay. Now, doctor, could you tell me why do I have to take the second dose at all? I've taken my first dose. Why do I have to again go there after a month and take my second dose? Is it really
So
necessary?
yeah, it is necessary because when the trials were being conducted, we saw that the efficacy was not picking up as soon as possible. You get the jab, and you can't just say, okay, no, from the next day onwards, I'm fine, I'm protected. It takes a while for the immunity to kick in. Plus, we need to also know whether it will keep carrying on, right? So, if it's the immunity has kicked in, whether it continues to stay there or whether it tapers down. So, to address these issues, there was a booster dose. So, you need to take a second dose after 28 days to get to the levels which are adequate for protection.
Okay. Is it a possibility that in case I miss my second dose, it'll like adversely affect, say, the protection cover that I get from the vaccine, or not really?
Well, the reason why the when you look at the numbers, 71% for the Covishield as a protective, the amount of protection that is being offered is after the second dose. So that would mean the first dose would probably get you up to a 50 or a 40 or a 50, and
Okay.
then the second
Right.
dose brings you up further. That's why we're getting the two doses here.
All right, okay. That's helpful. One of my we have a good question that somebody's asked here. If they have a pre-existing medical condition, or will there be any short or long-term effects from the vaccine?
Absolutely not. You need to just monitor yourself in terms of, so you have, for example, chronic lung disease. You have some immunosuppressants you're on. Then you need to watch out because see, the next day the fever that you get might, put your condition into more trouble. You would
Right.
probably need. So that's the only thing you need to really watch out for. Otherwise, it's been safe and it's been tested on a variety of patients with a lot of pre-existing conditions. The ones which are usually seen, the usual comorbid conditions, your diabetes, your hypertension, you've got a weak heart, you've got a weak lung, you've got some clotting issues, all these patients actually need the vaccine more because it's going to provide you protection against the virus, which would actually cause a lot more havoc. The vaccine itself would not cause much issues.
Okay. So we've already got a question here, and before you came in, we had another question regarding blood clots forming due to the Pfizer vaccine. Is there any real proof to this, or why is this happening if it is?
So there were a few patients that developed this after the Pfizer vaccine, and there were around 30 odd patients that developed clots after even getting the Covishield vaccine in Europe, which led to them pausing the rollout of the Covishield vaccine in Europe up to about 5 to 6 countries in Europe did that, and they wanted to review the data and see whether it's actually correlating. Is it a causal relationship that you're getting the vaccine and immediately forming this? But if you look at the numbers, 30 odd people developed clots after Covishield, but around probably more than 3 million doses were administered. Now, if you look at the percentage of getting a blood clot in a normal population, forget about vaccination, the numbers are more. If you look
Okay.
at a population of 3 million in a random place on earth where there is a preponderance to getting clots, it will be much more. So then, 3 days ago, it seems they reviewed the data and found there was no causal relationship, and they've resumed
The
vaccinating with Covishield.
vaccination.
With respect to Pfizer, there was
Yeah.
what they were saying is there were some components of the vaccine which probably reacted with these certain cases. That was not a big number again.
Okay.
So yeah, so again it was passed off, and I guess they will resume the Pfizer vaccine itself.
All right. Okay. Now, in case all of the viewers here, they do go and take the vaccine, how long would this, the COVID cover last for us? Would this be a lifetime thing?
No, we are not expecting it to give us lifelong immunity. Usually, any influenza, any viral vaccine that we're giving, any antiviral vaccine that we're giving, gives you a cover of around a year. That is because you'd have heard of late that we're talking about mutations of the virus. There's a UK variant, there's a South African variant, there's a British variant, Kent variant, and then so what happens is over a period of time, this virus also mutates. So we need to even get this virus, get the material of this virus, and then again inoculate ourselves. So right as of now, we do not know whether it will give us a coverage of more than a year. But what my take on this topic is that probably we'll have to get vaccinated yearly.
Okay. But is there always a possibility that eventually in the future we will reach a point where we'll eradicate the virus altogether, or we'll come up with a vaccine which gives us that lifelong cover? Is that a possibility?
Can't comment on
You
this
can't
part
tell.
right now. Yeah. Because the way the virus is behaving, the way we know viruses behave, we the the entire actually the whole practice of trying to get a vaccine is to eliminate this, but
Right.
we are not able to. We are not able to. As of now, we are not able to.
Okay. Uh, just another question. So there's no possibility. Oh, how is this possible to get COVID even after the second dose of vaccine? It is, right? I mean,
It
if
is.
I
It
think
is.
it is possible.
We have had many patients, and we probably the media has also covered a lot of cases where people have got their first dose and so a few days later have developed COVID, or got their second dose and then have developed COVID.
Right.
So what we need to know is that it takes almost a month for the immunity to kick in, and within this month you're still prone to getting COVID as much as another person. So you just get what mistake usually people do, and it's human tendency that once you've got the shot, you're obviously confident and you're feeling better that you're protected, and then you
Correct.
go about not doing the usual basic
Not
three
taking the
rules of
precautions.
the precautionary three rules of social distancing or masking or even sanitization.
Right. So it is always important to maintain those precautions even after getting the virus.
Yes,
Even
exactly.
after getting, I'm sorry, even after getting the
Yeah.
vaccine. Okay, I want to ask you, one of my friends actually asked, he has a toddler. So he wanted to know, what about the kids, toddlers, or even breastfeeding moms? What about them? Can they get the vaccine, or should they get it?
For now, pregnant people, the women who are pregnant or breastfeeding are not uh, been told to take the vaccine because we still don't have enough data on such population. Secondly,
Okay.
for kids also, we've got trials underway for kids above 12 and below 20. So we'll see how the trials come up, and I think in the near future they will also be incorporated in this. For now, it's we are targeting the people who are most at risk. So the ones who are with comorbidities and ones who are older.
Hmm. Now, we have another question. Uh, Somebody has G6PD deficiency, and they're saying that it's not safe for them to take those vaccines. Is this true?
Yeah, so people with G6PD deficiency, people with certain drug allergies are being told to hold on for now. We are still trying to figure out, and even those with who are on blood thinners, they are also being told to hold,
To
because
hold on.
if
Okay.
yeah, because that is basically not because of the system going into overdrive or it's going to cause you a bigger issue. The blood clot, the your blood thinners will also, you not, if you're on a good enough dosage of blood thinners and you get the jab, it's an intramuscular injection, so local issue can turn up where you can have some amount of bleeding going on and you might land up in trouble. So that's why they're advising those. So if you are on blood thinners, you need to uh, you know tell the same to the vaccine provider, and he will tell you how to go about it, whether you can pause your drug at all for a couple of days. You speak to your cardiologist or the doctor who's
Hmm.
basically prescribed you the medicine, and he will guide you on whether we can stop it for a couple of days right now, and then you can take the jab and restart it.
Fine. I think that covers a lot about what's going on in India, Covaxin and Covishield. About the symptoms we've covered. We've covered regarding the dosages, how to get yourself registered. Can we talk like a little bit about what's going on around the world? Do you have any news? I heard that India's practically sent out more vaccine, to other countries than it is actually used in the country itself. Why is that? Do you have any idea regarding that?
So we, especially the Covishield, which was being produced since a while now, since the time the trials started for the Oxford AstraZeneca vaccine, um, Serum Institute of India had started producing the vaccines, so that if the trials pass, it was a risk that they took. The trials did pass, so we could immediately start giving out the vaccines. However, the rate at which the vaccines can be given, we cannot attain a huge rate compared to the population that we have. We cannot think of vaccinating our entire country within, say, a month or two, or probably even six.
Right.
So what happens here is that every medication, every vaccine has a shelf life, and with the vaccines lying around
80.
just to be given to an Indian population would not have made sense, because it would have also caused an issue with the drug, with the vaccine itself. So to
Right.
avoid these shelf life issues, it was decided to also start exporting, so that one batch does not lie waste, and there'll be enough to be given around, as well as uh, there is enough to actually start the rollout in India itself. And what we've recently got to know is also they've doubled the capacity. They have been increasing from around 5 crore doses to around 10
Hmm.
crore doses, is what they're aiming to achieve within a month or even lesser. So they are boosting the production rates, and at the same time they will have to continue exporting too.
Right. Now, I've heard that the vaccination drive, I mean, so far it was really going well, but now the numbers of the jabs that are being given are dropping, while unfortunately the second wave is coming much closer to us. So what are your thoughts on that?
It is quite unfortunate, because we began with vaccinating the frontline warriors, your healthcare workers, the police, the BST conductors, drivers, etc., etc. Those turnouts were as expected. Again, we didn't have 100% turnout, which was very surprising and disheartening. Then they have started with this second drive, where we've started with people above 65, who are aged above 65, to come forward and take the vaccine. Again, because of the skepticism with regards to this vaccine, we had a good turnout to begin with, mind you. We were getting a good crowd. Especially if you talk about Mumbai, you talk about other cities around India too, we were getting a good amount of turnouts for these vaccines. However, especially with the issue that had come up with regards to clots, and the European nations, many nations actually holding the Covishield vaccination programs for a bit. It has caused a lot of doubts in the people's mind, and people are not turning up right now, which is
Right.
detrimental to our entire drive. We already have a second wave coming. Cases are rising as we speak. We are short of beds already, and it's March, and I think April is going to be difficult again, because the vaccine would definitely help us in avoiding the numbers go up so fast. And we already are at a disadvantage with not able to vaccinate many people at once. However,
Right.
with the small amount that we are able to, we are still facing shortages. We can't force a person; it's voluntary,
Correct.
and it is quite disheartening to see that people are still not coming forward and taking it. The numbers have really gone down.
So, do you have any strategies in mind regarding how you can increase the value of taking the vaccine? So, from what I heard in Dubai, they have something like vaccine offers going on. So, if you've taken the first dose of vaccine, then you'll get a certain discount at certain products at certain stores. So that's a very lucrative and very creative way to attract people to be like, okay, no, I think we should go and take the vaccine. Do
Well,
you have anything in mind?
I feel first and foremost we already have uh, most of the government centers giving it out for free. And even if you want to pay and get the jab, it's barely 250 rupees. So
Right.
we are already, these incentives should be actually good enough.
True.
However, we will probably have to do something like on those terms to actually draw some more crowds. And well, frankly, I've never thought of giving a life-saving drug, and you're telling you're giving some amount of incentives for the patient to come and take it.
Correct.
So it should
Correct.
be just probably people should not be waiting for any freebies. If you want to get it free, you can still walk in, and
Right.
you want to be some amount of you still feel okay. You want to go to a private institute, take it. Might as well pay just 250 rupees.
Right. Now, some people ask me why are the private hospitals charging money at all? But I believe that's just the premium that private hospitals would charge, because you're basically cutting into a lot of cutting the line
Yeah,
when
in terms
compared
of,
to going
I
to
would also
public
say
hospitals.
they're providing the service. There's someone there to give you the vaccine. You have to actually go about, you know, keeping a designated area, for safety, looking at how to go about things in terms of your staff, which is being dedicated to all of this, and the vaccine itself. So, I would say still, if you look at how vaccines are otherwise, you talk about the influenza vaccine, it is probably it's close to 2,000 rupees. You talk about a
Okay.
pneumococcal vaccine is close to 3,000 rupees. And here you have a vaccine which is basically to fight the pandemic, and it is barely 250 rupees. So I was expecting the price of the vaccine to be higher, but they have, I think, done a good job by keeping it this low.
It's so reasonable. Now, you said we have the second wave coming and everybody's aware of that. What can we expect? How similar will the second wave be to the first wave and our first experience now that a year is almost coming to an end, the COVID year. What do you think the second wave will be for us?
As of now, the trend is such that most of the people are getting milder infections. However, when the numbers rise, the infection severity also rises because you're exposed to a lot more people having the virus.
Right.
So I would probably see a difficult time coming up. The only way to actually go about it. So there's a lot of fatigue also involved in terms of the entire process of the precautions being followed. It's been a year and you've been still roaming around with the mask,
Yeah.
trying to socialize. Human, as a human tendency, you would not want to. You would want things to go back to normal, and people have already started taking for granted that okay,
Correct.
it's been a year and things are better, and the vaccination's going on, but yet we are seeing a big surge in numbers since March, and it's going to take some time. It's not going to come down soon, is what I look at. and severe infections, severe people with severe disease are also now streaming in. ICUs are getting full, and
Right.
I don't see. So the only difference between last year and this year is now we know how to deal with the disease once it's in the mild, moderate, or even the severe category. Yet we don't have a drug, a single drug, which would say, okay, you can offer this drug and you will be safe. So still we need to be careful. We still need to be as vigilant as possible not to get the disease, because we are still not. We don't have a single answer. We don't have a single drug to say, okay, you want to get this drug and you will be totally cured. We still have got a gray area in the treatment part.
Right. Somebody here has asked us if somebody just recovered from COVID, is it, they say that you shouldn't be taking the vaccine for at least few months. Is it because they must have probably developed the antibodies for it? Or,
Yeah.
what do you think it is?
What the government says is you can take a vaccine after 14 to 15 days after you've got the disease. And once once you're absolutely fine, you're not having any
Hmm.
issues post the disease. The other way to go about it is you can go about checking your antibody levels. If they are adequate, you can wait. If they are not adequate, you go for the vaccine.
I think that's a great way to at least
Yeah,
have an idea if you want to take, if you need to take the vaccine, or if
yeah.
your body is ready to take the vaccine. Otherwise, besides that, I think we're done with about almost all the questions. If there's any last words that you want to tell everybody listening, just like a parting message regarding why we had this chat at all, and why it's important to get the vaccine done ASAP.
My take-home message would be for everyone to know that that vaccine is safe. No matter what you see, no matter what you read about or see on the television, somehow the negatives are being highlighted, but the positives of the vaccine are there, and we'll be able to see that as time comes. That the vaccine is the sole, denominator that's helping us get these cases down, get us closer to normalcy. Secondly, we still, despite taking the vaccine, not everyone's vaccinated yet, and there will be some amount of transmission with regards to the virus still in the community. So, despite taking the vaccine, you must continue following the precautions and stay away from the disease as much as possible.
Right. So, doctor, if in case we have patients who want to reach out to you, or where can we find you? Which hospital can we find you at?
Uh, I am associated with the hospitals around Mumbai. So I'm associated with Saifi Hospital at Charni Road, Bhati Hospital in Tardeo, Global Hospital in Parel, and ACI Kambal Hospital at Kemps Corner. Whereas in Chembur, I'm associated with the Sushruth Hospital as well as Zen Hospital. You
Okay.
can reach out to any one of these hospitals and get in touch with me.
All right. I think we've covered a lot of topics, and I hope people are now, brave enough to get themselves vaccinated and understand that it's important. It's an important tool in fighting the second wave.
Definitely. And I hope most of the people, whether they are not yet in line to get the vaccine, should convince those who are within their family, within their friends, and should be, giving this goodwill of that. There's no point waiting for more data. There's no point waiting for some more time to see how this pans out, because the disease does not give you time at times.
True. That's a good line. The disease does not give you time. All right. Thank you so much, Dr. Abhijit. This was very insightful, and I thank you from all of the viewers and from House of Cure for being the first guest at DocTalk. And I hope we'll meet each other again at the end of, say, another 6 months, where we'll have an update regarding, all of these questions that we just asked, and our knowledge and our viewers' knowledge can grow together.
Definitely. Thank you for having me for this talk. And I'm sure, I hope next time we try and get this, we do this talk not virtually but in person, as well as
Absolutely.
I quite like the entire idea of your the setup of House of Cure, where you
Thank you.
guys have really done a good job with giving all the benefits to the doctor as well as the patient at one time, which is difficult to attain. And I wish you good all the best with that. Yeah.
Thank you so much. All right.
So thank
Thank
you.
you. Have a nice evening.
You
Thank
too.
you, guys. Have a great evening. Bye bye.